If you are experiencing symptoms such as generalized body weakness, nausea and vomiting, fever, abdominal pain, loss of appetite, and joint pain, you might have developed hepatitis. Yes. Though other infection processes also have similar symptoms, like malaria, typhoid, also have similar symptoms of abdominal pain, fever, generalized weakness, vomiting, loss of appetite. Good. Now, how do you differentiate to know if you have developed hepatitis? If these symptoms is associated with jaundice, jaundice is sudden yellowish color of the eye and the skin. You understand? We notice sudden yellowish color of the eye and the skin, then which is associated with dark urine, dark stool, right? Then definitely you have come down with hepatitis, or you have been infected, or you have developed hepatitis. Now, what is hepatitis? Anyways, good morning. Welcome to today's Health Talk. As you know, my name is Nurse Ibe Crescentia Ngozi Chukwuka. Now, hepatitis simply means inflammation of the liver. When your liver becomes suddenly inflamed, that is what we call hepatitis. And there are different causes of this hepatitis. Apart from the viral causes, we have other non-viral causes that can be caused by excessive intake of alcohol, smoking, etc. Or some certain medications can also predispose you to develop this hepatitis. But now we are going to focus on the viral causes of hepatitis. With that being said, there are about 5 viruses that causes hepatitis. We have hepatitis A, B, C, D, and E. Now, we are going to talk about the facts about these viruses. We are going to start with the good facts about them and then the bad facts about them. The good facts about these viral causes of hepatitis is that hepatitis A and hepatitis B have vaccines that can be used to prevent them, to protect you from getting them. That is one good fact, right? Another good fact is that hepatitis A, hepatitis C, hepatitis D, and E is curable. Yes, we have medications that you can take and you will get better. Then, the bad part is that hepatitis B is not curable. Yeah, that's the bad part. Hepatitis B is not curable. It can lead to a chronic disease if it's not detected early, and that might be a lifetime something that you need to be on medications in order to live healthy. So that is one of the bad parts of these viral causes of hepatitis, right? Now, what are the routes of transmission of these various viral causes of hepatitis? Hepatitis A and hepatitis E have similar routes of transmission. You can get it through contaminated food and water. While hepatitis B, hepatitis C, and hepatitis D have similar routes of transmission, that is infected blood, semen, that is vagina secretion or semen. We have also needle prick. It can also be transmitted from mother to the child during childbirth. That's another risk of this hepatitis B, C, and hepatitis D. But the thing is that hepatitis B and D always occur together. Oftentimes, when you have hepatitis B, it's possible that you have hepatitis D, right? Because both of them they have the same route of transmission, right? Then another fact you should know about this hepatitis is that hepatitis B, C, and D cannot be gotten by mere kissing or mere hugging or handshake. You get it? Cannot be gotten by mere kissing or hugging or handshake, unless the person, your partner, have a sore in the mouth, an open wound in the mouth that is bleeding, and you yourself also have an open wound in the mouth, right? That is the only way you can get it. You can get this hepatitis B, C, and D by kissing, but it doesn't occur often. You understand? So the probability of it occurring that way is not possible, because these viral hepatitis, they have specific route of transmission, of which if it is not that route, you will not get it. Just like I told you, hepatitis A and hepatitis E is gotten through contaminated food and water. We call it fecal oral route, right? While hepatitis B, C, and D is gotten through contaminated blood, body secretion, semen, fluid, etc. Now, how do you differentiate which hepatitis that you have? The only way you can differentiate the hepatitis that you have is by running a blood test. Yes, when you run a blood test, it can be able to differentiate which hepatitis that you have. And another way you can differentiate which type of hepatitis you have is by their mechanism of by their disease process. Like hepatitis A, hepatitis C, hepatitis D, and hepatitis E they usually have acute symptoms that they resolve on its own. Understand? They just take within few weeks, your body might be able to fight it off. But hepatitis B, if not managed on time, has a way of developing a chronic symptoms or conditions that it is not curable. Yes, it is not curable. So once you have hepatitis B, you just have to manage the symptoms, and you have to be on medications for you to live a healthy lifestyle, right? So this is why early detection is very important. If you are sexually active, early detection of these viruses and other STIs is very important to protect yourself, so that you can be able to protect yourself on time. Also, getting vaccinated for most of these sexually transmitted infections that are not curable is the only solution to protect yourself, because once you develop them, it is not curable. So there are some viral medications that are very effective in helping you to live a healthy life once you develop hepatitis B. Yes, once you develop hepatitis B. But it is very, very important that you go for early screening. At least if you are sexually active, you should do a yearly screening for this hepatitis B and other viral STIs, right, in order to protect yourself. It's very, very important. So time is ticking. There is no time. Everybody can be a victim. So don't think that you're not a victim. Everybody can be a victim. As long as you are not protected, you are a victim. So do visit a hospital or a clinic to check your status for this hepatitis, and also get vaccinated, because remember, prevention is better than cure. Thank you. See you next time. Bye.